My name is Ron Rapee. I'm a Distinguished Professor at Macquarie University and I'm the Director of the Centre for Emotional Health. The mission of the Centre for Emotional Health is to develop a better understanding and knowledge and to build materials for assessment, treatment, prevention of emotional disturbance and emotional distress. Difficulties like anxiety disorders, mood disorders, depression, stress problems, and so on. My own personal research has focused mostly on anxiety and anxiety-related disorders, pretty much across the lifespan, although in recent years I've focused mostly on younger ages. I've conducted work with children, middle-aged children and adolescents, and I've been responsible for developing the Cool Kids program, which is a program that helps parents and children learn how to better manage the child's anxiety. Probably my most exciting research recently has also been the development of what we call Cool Little Kids, which is a prevention program for preschool-aged children, where children who are very shy or withdrawn or inhibited, but don't necessarily have major problems, of course, at this stage with anxiety, their parents come in and learn how to help their child build confidence. And we've found that over the years, down the track, those children whose parents have been through the program are actually less likely to have anxiety problems several years later than children whose parents have not been through the program. One of the features of the Centre for Emotional Health is that we have a very strong applied focus. And that applied focus is probably best realised through our two clinics. We have the Emotional Health Clinic, which is a standard practising psychology clinic, where our research programs are translated into application and members of the public are able to come in and take part in our treatment programs. And in turn, those members of the public provide us with more data and research to continue to improve our programs all the time. The other clinic is a very innovative clinic, which is called the E-Centre Clinic. And the E-Centre Clinic runs very similar sorts of programs to help people manage anxiety and depression, but it's all done over the internet. So people are able to access those programs and are able to use them from any parts of Australia at all. Some of the examples of some of our applied programs include programs for preschool children, teaching parents how they can build confidence in their children, programs for adolescents with mixed anxiety and depression, programs for adults with social fears, generalised anxiety fears. Probably our best known program is called Cool Kids, and it's actually a suite of programs that's really all aimed at helping children to build confidence and better manage their anxiety problems. Two of the other strengths at the centre that I think are really important are our focus on research training and also on clinical training. We also run regular training workshops around Australia and also around the world, training professionals in delivering our treatment programs. And we also have a number of visitors from around Australia and particularly from all around the world who come and occasionally observe some of our treatment programs. Within our clinics, within our main clinic at the university called the Emotional Health Clinic, we see around about 500 or so participants every year. So over the last several years we've seen thousands of people with anxiety problems and depression problems. In the E-Centre Clinic, because it's an internet-based series of internet-based programs, they actually see several thousand people, or they don't actually see them, but they actually treat several thousand people every year. The centre has a very strong international reputation. We get visitors, both academic visitors and clinical visitors who come to the centre all the time, and I think that's a really exciting part of being part of the centre. We also have a number of our programs that are also translated into languages and are used all around the world. Cool Kids, for example, is used in probably about 12 or 15 countries around the world and is translated into at least half a dozen different languages. I'm confident that the Centre for Emotional Health will continue to grow over coming years, that we will expand our offerings and continue our groundbreaking research to help people with anxiety, depression and related emotional difficulties around the world.